I want to welcome everybody, and we're going to start. I thank you all for coming. What a beautiful attendance, a great audience, a diverse audience. I want to welcome my graduate students who are here because I teach Wednesday nights, and thank you all you have to come anyways, right? So I have the graduate students here. Also, I want to recognize all the many MPH students, EMPH students, and alumni in the diverse community population that we have. Not only we have faculty and students and staff, but we have representatives from Providence, Cedars, Memorial, UCLA Health System. It's really nice to have you all here. First of all, I want to thank Eric and Steve and Yael for their coordination of this event. It takes a lot of logistics to put something like this on, and I really appreciate their help. I want to acknowledge that this is called the Paul Torrens Health Forum at UCLA Fielding School of Public Health. And Paul, where's Paul? There he is. Well, see, a quick story. When Paul Torrens became the department chair back in 1972, I believe it was, I was in the one-year master's program, and during our student internship, we had a report out. And this wonderful, nice, unassuming man was in the back. We didn't know who he was. He was just, and then Addie Lou Klotz, who Paul remembers, said, I would like you to meet your new department chair. And it's the kind of character that Paul has. He's unassuming, but he's powerful. He is loved by his students, and his love to the community, for UCLA to give something back, is recognized by his name on these forums. And so we applaud Paul for his continued efforts to bring this kind of education to the community at large. This will be my fourth forum that I've had the privilege of organizing and moderating. The last forum I did was on MACRA, and I, in meeting with the advisory folks for this forum, they said, you got to do MACRA again. Do we all know what MACRA is? It's called the Medicare Access and CHIP Reauthorization Act. What is CHIP? I asked that question, a lot of people don't know. It's the Children's Health Insurance Program, Medicaid. So we're talking about the biggest change in healthcare law since Medicare was instituted. The MACRA is going to transform, I believe, healthcare, and why was it created? Dr. Bill Barcelona from CAPG is going to talk about the legislation, but recognize that the government would like to know what its spend rate's going to be. They would like to take fee-for-service towards, quite frankly, a capitated model. Risk. MACRA pertains to fee-for-service. It's going to move, and this is the talk is from volume to value. Well, how do you assess the value? It's going to be a lot of reporting, folks. EMR is going to be absolutely critical. A lot of reporting, a lot of metrics. 50%, I'm seeing articles that say 50% of the physicians don't even know what MACRA is. And certainly that's a concern. The reason why we're putting on these forums is to try to educate the population, the folks in healthcare, the consultants, the physicians, what they're going to be faced with. This is going to transform how we deliver care. It is going, I believe, to move physicians, independent physicians, into large organized groups. Very hard for them to maintain a solo practice, I think. So we're going to really launch into the presentations. Let me introduce briefly the panelists, and then Bill Barcelona will be stepping up first. He's a senior VP of government affairs for CAPG. CAPG is the professional organization that we in medical groups that take on risk or health systems, capitated model. They're our professional organization. Their advocacy back in DC, they've influenced the creation of this law. They're educating our members of Congress on the capitated model. Of course, we believe in it. We believe that this is the right direction to go, but recognize 95% of practice of medicine is fee-for-service. So we got a long way to go to transform. MACRA is going to help do that. I think that one final note is that, and this is what I teach here at my classes at UCLA, that our goal is, and our driving force is the triple aim. And that's what this driving force is. Bending the curve down on cost, increasing quality, so you get value, quality measured by clinical as well as service, very important. And then population health, that in managing a larger population, everybody gets healthy if you do it the right way. May I say there's one other modification to the triple aim, and that is triple aim plus one, the quadruple aim. What is that plus one? It's taking care of the providers so they don't burn out. Now there's a challenge. Look at the reporting requirements in MACRA and what our providers are going to be faced with. So we in administration have a responsibility to create that environment so they can give good care and minimize disruption in reporting and EMR, make it work. You know, that's why we have some great physician leaders.